Years ago when I was working in the emergency department at Hillcrest Hospital, I got a call at home from a guy named Sabatelli, and he introduced himself and asked what I was doing. I said something like, well, not much. And he said, well, why don't you gather your stethoscope and come on down and work a shift at Fairview because things are going to change.
Some of Dr. Sabatelli's vests were leather.
And I was pretty surprised to find a very cool guy who was a really good doc.
A little ray of sunshine.
But I think they looked at him first with curiosity and eventually with great respect.
Ray did have a lot of foresight. He had a vision for what the ED was going to be, and I think he was very successful in that endeavor.
I'm Dr. Raymond Sabatelli, your Fairview Hospital emergency doc. And I'm going to take you from what is probably the Jurassic period in my life up to closer to modern times. Who better to tell that story than a dinosaur like myself? How many people do you know that start off doing something and do it for 40 years in the same place? So I'll start the story when I was a resident at Albany Medical Center. And I was trying to get a feel for medicine, for myself, where I was going, and I was having trouble doing it. So enter Alice. You remember Alice, there's a song about Alice. Alice shows up at the hospital in Albany, and we meet, and she said, hey doc, the way she always talks, why don't you come up to the Berkshires and take a look? And I said, why not? So on the next day off, I got on my motorcycle and got shown around the Berkshires. Who wouldn't love the Berkshires? I mean, it's like drop dead gorgeous. The whole story about Fairview Hospital and where that all came in was a phone call from a doc who was working at Fairview Hospital, never even heard of Fairview Hospital, and asked if I could just cover a shift once in a while for him in the emergency room. And I said, why not? The whole scene at the hospital, I was not even prepared for.
There was only one nurse at night. We had to call the doctors almost every night. Sometimes they'd be awake, sometimes they weren't awake.
There was no 911.
Doctor whoever could cover whenever.
So here I am, I find myself in this position where there's opportunity. Opportunity that befalls few people, where you can come in on the ground level and potentially create something, because there really wasn't a formalized practice of emergency medicine, not there or anywhere, and took on the full-time role as emergency doctor.
We were kind of said, wow, who is this guy?
He was very good looking, very handsome. So everybody heard about this new doctor and everybody was making excuses to stop down in the emergency department.
President of the Board of Trustees at the time nicknamed him Dr. Clogs.
He was the first doctor who I've ever seen who wore clogs to work.
He had the clogs.
The clogs.
Clogs.
I mean, you can hear him clicking, clacking.
You could hear him coming from a long way away.
And I'm not even trained enough yet. I sat for the emergency boards, passed it, which was extraordinary because it was like 75% failure rate.
It was nice to see that a guy like him in this small hospital be the only board-certified ER doctor in the county. I mean, it was thrilling.
Ray gave us a lot of firsts. He was the first to use physician's assistants in the emergency room. Ray was the first to create the new designation of emergency medical technicians intermediate, which allowed them to start IVs in the field. And all that led to Ray making his movie.
I got a grant from the state to do a movie, Enter Polytrauma.
Be advised, 3-1, you have an MV-16 with PI.
Easy. Fairview Hospital, Southern Berkshire Ambulance, Tech 114. Tech 114, this is MD-11. Go ahead.
The victim's chances of survival are greatly improved by the immediate, aggressive management of shock.
Start an IV with lactated ringers, large bore catheter, run it wide open.
Polytrauma did win some awards in various film festivals.
In today's parlance, went viral.
He was ecstatic about that.
Fairview Hospital was really getting a name. The emergency department was starting to really take shape. I was having a great time.
Oh, he was playing guitar. I mean, he's a blues guy.
Ray loves the blues.
We had a ball.
Okay, so now fast forward to today. In leaps and bounds, things have changed. I mean, so fast. Right now, we have paramedics.
We can deliver state-of-the-art care well before you get to the hospital.
Hi, I'm Jeremy Van Duzen, and we're going to show you what's new with the Southern Berkshire Volunteer Ambulance.
Hi guys, my name is AJ Anderson, and I'd like to tell you what paramedics can do on a truck compared to what we used to be able to do before. The first thing we have here is a cardiac monitor. We have a IV kit, so we can start IVs. We have a CPAP, so we can help people who are having difficulty breathing. We have a IO kit. The IO kit is able to give us IV access. Paramedics have about 35 drugs that we can give. Paramedics can intubate and secure their airway. And also as a last resort, paramedics are also able to do needle crikes. If the airway is compromised, we are able to give them a secondary means to breathe. So as you can see with all this equipment, we are able to provide life-saving interventions in the field like a mobile emergency room.
Treatment of patients in the ER changed dramatically. Technology changed it. Ray was very much a proponent of getting new ultrasound equipment. CT scanning, now you do CT scans primarily through the emergency room, and he was a big pusher. We needed that stuff, and he was the one out there on the front lines getting it for us.
The important part of being at Fairview is the outstanding care. But when you need advanced care, they know how to get you to the right place.
So a lot of these cases might be referred to BMC for more complex medical care, more complex surgery.
So we can take any problem and then transfer them to the higher level of care at another facility if need be.
The whole idea of the Fairview family, I think, originates from the ER.
And just that hug at the end of a tough shift with the folks you work with just really helped you get through the day. And we do hug a lot.
When you look in total of the single would-be emergency doctor walking the face of the earth in a prehistoric time to where you come upon Fairview Hospital as a really sophisticated, state-of-the-art kind of place. It has been an incredible ride. I've been really fortunate to have been in a position to jump on that bandwagon and direct it and drive it, be surrounded by people who got as excited about this stuff as I did. So I want to take this opportunity to introduce you all to Dr. Alec Bellman, who is the new chief of the emergency department. He's got youth and chutzpah on his side, you know, and I'm backpedaling out of the emergency department, though I'm still working a shift a week, at least presently, and then I work in the wound center as well. But nonetheless, this be our man, and we're just thrilled to death.
It's been the best job I've ever had. What's great about this job is who you work for and who you work with.
I have seen a lot and have seen this hospital grow from a very small community hospital with a fabulous reputation for their patient care.
Hopefully you will never need us, but if you do, rest assured, Fairview is ready.
Thank you, Ray.
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 This is for you, Ray.
Gypsy woman told his mother, this no ordinary son, gonna save a lot of lives before he is done. Folks stay in trouble, they know who to call. The man that made the ER here, one of the greatest of them all, that's a Ray. Everybody knows a problem like nobody can. Seen every kind of trauma since the ER began. When folks hear this sound, they're in good hands. On that we guarantee. Calling Dr. Sabatelli, this is an emergency. That's a Ray. Oh, everybody knows it's a Ray. Ah, he's the man who made Fairview ready and able to save the day. Oh, he's the man that made the emergency team at this little rural hospital one of the greatest there is. Thank you, Dr. Sabatelli. Thank you, Ray.